Welcome to Premier Derm Center. This video is intended to give you information on what you need to do to be able to take Accutane as required by the government in the United States. You are about to start Accutane pills to treat cystic-resistant scarring acne. The generic name of Accutane is isotretinoin. For the rest of the video, brand name Accutane will be used for the ease of pronunciation. Before starting Accutane, you should know that treatment with Accutane takes about 4 to 6 months. The treatment course requires monthly blood draws, no pregnancy during the Accutane course. You must be on 2 forms of contraception. You must be able to return to the clinic monthly for refill and follow-up visits, as no refill will be given over the phone. There are various deadlines with which you have to comply as required by the government. You should not donate blood during and shortly after your course of Accutane. Before starting Accutane, you need to let us know if you or your family has history of early heart attacks, high cholesterol, liver disease, inflammatory bowel disease, depression, osteoporosis, rhabdomyolysis, and if you play high-impact sports regularly. All Accutane patients in the United States must be enrolled in an online national registry called iPledge at www.iPledgeprogram.com. Accutane is only prescribed by physicians who are registered with iPledge program and is only dispensed at qualified pharmacies, which must be registered with iPledge program as well. Before you can begin Accutane therapy, you must sign an informed consent, which lists many risks and possible side effects that one can encounter while taking Accutane. Do not sign this form until after you have read all the information on it and all your questions are answered thoroughly. In the United States, each patient who has consented to taking Accutane receives a unique iPledge ID number. This number is required for your registration at www.iPledgeprogram.com. Keep this unique number in a safe place. Do not share this number with anyone. You may need this number at the pharmacy to pick up your Accutane. Should your course of Accutane be interrupted, you will need the same iPledge ID to re-enroll with the iPledge program at a later time. It is very important that if you are a female who can get pregnant and about to take Accutane, you must agree to no pregnancy during the month before the course of Accutane, during the course of Accutane, and the month after Accutane course. You must have 2 negative pregnancy tests separated by 30 days before you can begin purchasing and taking Accutane. Hence, you must wait for about 30 days after your first visit to begin Accutane. You must have 2 acceptable forms of contraception, or you must have complete abstinence during the entire course of Accutane. We must have a negative pregnancy test prior to each month refilling of Accutane. You should remember as well that taking Accutane requires blood work done at every month during your treatment course. These monthly lab works are done to monitor your pregnancy status, your liver function test, your triglyceride level, and your complete blood count. You need to get the labs done 2 to 3 days prior to your appointment visit, so we have all of the necessary information to prescribe you the safest amount of Accutane at every visit. For accurate results, you should fast the night before blood works are done. Accutane capsules come in 4 dosages of 10, 20, 30, and 40 milligrams. At every visit, please remember your dosage. Knowing your dosage makes it easier for your doctor to adjust your Accutane safely for you. To get started with iPledge program registration. After you have signed the consent, let us know if you want iPledge program headquarters to communicate with you via regular mail or email. Once we have your first set of labs results, and if they are normal and hence it is safe for you to start Accutane, we will register you in iPledge program, which will then mail you your username and password to log into www.iPledgeprogram.com later, when it comes time for you to register yourself. After your first visit, you need to return to the clinic in about 35 to 40 days. Remember to get your labs done before returning to the clinic. It is at this second visit that you can receive your Accutane prescription. We will confirm you an iPledge program after we receive your second set of lab results and we know it is safe for you to start Accutane. At this time, you need to register yourself online at www.iPledgeprogram.com using the username and password that iPledge had sent you. Answer a set of survey questions and pick up your Accutane at an iPledge registered pharmacy. You then will be on your way to clear skin. Remember, you must return to the clinic to get your refill at subsequent monthly visits. We will reconfirm you in the iPledge program at every monthly visit, and you need to register yourself online after each of these follow-up visits at www.iPledgeprogram.com to answer a set of survey questions. Afterwards, you can pick up your Accutane at the pharmacy within 7 days after the date of your pregnancy test. Remember, you must answer the iPledge program survey questions and pick up your Accutane within 7 days after we had confirmed your negative pregnancy status at every month, starting with the second visit. Take your iPledge ID with you to the pharmacy in case you are asked by the pharmacist for confirmation. Again, the deadline for picking up your Accutane at every visit is 7 days from the date you had obtained your lab, which we will need to register you at iPledge program. Please do not miss this important deadline because you might be asked to wait for an unnecessarily long period if you are late at answering your survey questions or if you are late at getting your labs. While taking Accutane, you should avoid prolonged sun exposure because you will be more sun sensitive. You need to wear sunscreen with an SPF of at least 30 every day on your face or any exposed body parts before going outside. Protect your lips with sunblock lip balm. Avoid waxing hair because you can get burned more easily from the hot wax. During the return visits, we will ask questions to see if you had encountered any problems with Accutane, monitor your treatment progress, and go over your lab results. You, of course, can tell us your concerns and any issues you have while taking Accutane. Tell us about your dry skin issues, any muscle pain, sun sensitivity, or depression symptoms. Each monthly visit while taking Accutane is a chance for you to be safe while taking this powerful anti-acne drug. Ultimately, we want you to look great and be safe on Accutane. Now it is time for questions.